Today we will demonstrate the proper technique for self-administration of intramuscular injections. Before we begin, we will assemble the various products and devices that we need to administer our self-injections. I'll review these one by one in a moment. Your testosterone will typically come in a box that looks like this. Inside the box will be a bottle. However, the dosage instructions are typically recorded on the box, so please do not discard this. Inside the box will be a bottle of testosterone. The typical concentration that is used is 200 milligrams per ml. Please handle with care so that you do not break the bottle. The most convenient syringe to use is a 1 milliliter lock syringe. Here it is shown both in the package and outside the package. Always make sure that there is no damage to the sterile packaging with your syringes or needles. An 18 gauge needle is used to withdraw the testosterone from the vial. Here it is shown both in the packaging and outside the packaging. Again, be sure the packaging has not been damaged. Do not use this needle to inject with. 25 gauge hypodermic needle. Shown here is a 1.5 inch length. This is appropriate for the gluteal injections. However, I recommend the 1 inch needles for injections in the thigh and the deltoids. You will need at least 4 alcohol pads, 1 to cleanse the vial of testosterone and 3 to cleanse the injection site. You may also use a bottle of alcohol and cotton balls if you prefer. At this point, I would like to instruct you on how to prepare the syringes for injection. Again, you'll want to assemble all the products that you will need. In this case, a vial of testosterone cypionate, your 1 cc lock syringe, 18 gauge needle for drawing up your testosterone, 25 gauge needle for injecting your testosterone, multiple alcohol swabs to cleanse the vial and the injection site. The first step is to cleanse the testosterone. We will take a single alcohol swab. When you initially get your vial of testosterone, it's likely to have a metallic covering over top of the rubber hub. After you remove that, you'll see the rubber port. You can cleanse that with the alcohol. I usually let the alcohol swab just sit on top of the testosterone to keep that sterile. At this point, you'll want to grab your 1 cc lock syringe, peel back the sterile packaging. You can then set this down, keeping the tip in the packaging to ensure that it remains sterile. You'll then want to take your 18 gauge needle. Again, you're going to peel back the packaging from the top. Hold on to the packaging to keep it sterile. Be very careful that you do not contaminate the hub of the needle. At this point, you can remove the 1 cc lock syringe from its packaging. You're going to want to twist the 18 gauge needle onto the syringe. At this point, the cap of the needle will keep it sterile. I'd like to show you the 1 cc syringe in close-up. This is marked in 0.1 cc or ml gradients. Keep in mind an ml is the same as a cc. Your dosage may be listed in mLs or cc's. Remove the cap of the needle. Verify what your appropriate dosage is. In this case, we will assume it's 0.35 mLs or 0.35 cc's of testosterone cypionate. This is a fairly typical dose. You're going to want to aspirate air into the syringe up to the 0.35 cc mark. We're going to then inject the air into the testosterone bottle. This makes it easy to withdraw the medicine. We are now aspirating testosterone into the syringe. Try to avoid getting any air bubbles into the syringe if possible. If you do, we can address this later. So we've now aspirated the appropriate dosage into the syringe. There's always going to be a little medicine left in the syringe, or excuse me, in the needle. We're going to withdraw that into the syringe so that it's not wasted. We can recap the needle. Be very careful during this step. At this point, you can remove the 18 gauge needle. Never inject yourself with this needle as it's far too large and it's become dull. Get your 25 gauge hypodermic needle, and again, using sterile technique as demonstrated earlier, remove it from its packaging and twist it onto the lower lock connector on your syringe. Now that we have our 25 gauge needle attached, we're going to remove any air that's in the syringe by depressing the plunger. You can see how the air bubble is no longer there. You can then recap the needle. This will keep it sterile. You may set it down as you prepare the injection site. We will take a moment to review the various injection sites for self-administration of intramuscular medications. There's 4 primary sites: the deltoid, the dorsal gluteal site, otherwise known as a gluteal or, quote, butt injection, the ventral gluteal site, or various sites in the thigh, such as the vastus lateralis muscle. These really become a matter of preference. I'll describe the pros and cons of each site. We will first cover the dorsal gluteal injection site, otherwise known as the buttocks. If you divide the buttock into 4 quadrants, the safe zone for injection is the upper outer quadrant. Here we are looking at the buttocks from behind. This is the only safe quadrant as it avoids the sciatic nerve, demonstrated in yellow, and the vasculature, demonstrated in red. This is a depiction of the site on a live model. It's been blurred for modesty. If you divide the buttock vertically in half and then horizontally in half, you'll see the upper outer quadrant displayed. This injection site has fallen somewhat out of favor as it has the highest risk of injuring vital structures such as the nerve or vasculature. However, it may be the most comfortable in some individuals, and it also provides a large volume of muscle, which may be safer in very thin individuals. The downside is it may be difficult to reach in people with poor mobility. Another typical injection site is the ventral gluteal site. Here we target the gluteus medius. This site is located on the side of the hip or the side of the buttocks. This is easier to reach. This is one of the safer injection sites as it is away from any important blood vessels or nerves. It's also easier to reach than the dorsal gluteal site. There are many ways to locate this area. However, I find that the easiest to locate for self-administration is the diagram on the far right of this picture. Find the greater trochanter of the hip, which is the bony protuberance of the hip, and find a point about halfway between the trochanter in the top of your iliac crest. The injection site is located about halfway between these points, just slightly posterior to this. Probably the easiest area to reach for self-administration of intramuscular injections is on the thigh, in the vastus lateralis or the rectus femoris. Although easy to access, I find it the most painful. Here is a schematic of the 2 possible injection sites on the front of the thigh. Here we are looking at the right thigh of a patient. The shaded areas are the appropriate sites for injection. If you slightly extend your knee, you can feel a muscle belly that runs down the center of the thigh and another muscle belly that runs slightly to the outside of this. sort of on the outer front part of the thigh. If you arbitrarily divide the thigh into thirds from the hip to the knee, you'll want to be injecting in the middle third. While this site is the easiest to reach, I personally find it the most uncomfortable, but it's a matter of preference. Another appropriate self-injection site is the deltoid or shoulder muscle. This is a little easier to access than the gluteal muscle. However, it can still be difficult to hit the appropriate angle unless you're flexible. You find the appropriate injection site on the deltoid by feeling the fleshy muscle of the deltoid or shoulder muscle on the side. Feel the bony prominence of the shoulder. You should be able to find that shoulder joint. The injection site is going to be about 3 to 4 finger breadths below this. Here you'll want to use a 1-inch needle, no longer. Here is another schematic of the appropriate deltoid injection site. The appropriate area for injection is indicated by the triangle. Again, I would recommend a 1-inch needle, no longer. We are now ready for an injection. I'd like to review a very important step prior to injection, no matter what site you're using. Remove the cap of the needle. Testosterone is very oily and provides a good lubricant as the needle enters the skin. What you're going to want to do is press down on the plunger very, very slowly till you just begin to see a drop at the end of the needle. There it is. That serves as a fantastic lubricant and aids the needle entering through the skin. You'll really want it hanging off the tip of the needle, not down the shank as we have here. This is really how it should look, with just a single drop hanging at the tip of the needle. This will greatly aid your injection and decrease pain. I'll now demonstrate how to prepare the site. No matter where it is, you're going to want to cleanse the site with alcohol. If you have an injection in the hospital, they'll typically cleanse it once. I believe in ultimate sterility. The last thing you want is an infection. I clean the site 3 times with alcohol swab, or again, as discussed earlier, you could use cotton balls and a bottle of alcohol if you prefer. I actually find this much more convenient in the long run. Once the skin is prepared, you're going to want to grab your needle. Okay, again, you're going to want to make sure you have a small drop of liquid at the end of your needle. You're going to enter the skin at a 90-degree angle. Use your pinky to support it. I prefer to slowly slide the needle in, as I find that's least painful for myself. Some prefer to dart it in. Once you're in the skin, you're going to want to aspirate. That means you're going to pull back on the plunger, actually sucking in, as I'm doing here, and you want to make sure you don't see any blood. If you do, you may be in a blood vessel, and you should pull it out and find a new injection site. You may want to do this with a new 25 gauge needle. You then press down on the plunger. You can see I'm injecting the medicine. The medicine is very thick and oily, so it goes in very slowly through a 25 gauge needle. I prefer this over the bigger needles, however, as it's far less uncomfortable. When you pull the needle out, you may see a drop of blood. That's normal. What you prefer not to see is the testosterone flowing back out through the needle hole. It is fairly oily. If you do see this, you're going to want to apply a little bit of pressure and rub on the skin just to help seal the hole. Because I'm paranoid about infection, I cleanse the area one more time with an alcohol swab. And then that's it. The preceding video is for educational purposes only and is not a substitute for proper medical evaluation or advice. If you have any questions regarding self-administration of intramuscular medicines, contact your physician at Midwest Rejuvenation. For more information, visit our website at midwestrejuvenation.com. You can also sign up to become a client directly from their website.